Today, we are shining the light on cataracts, the leading cause of vision loss here in the country. I'm here with Dr. Rahman. You are with Kenyon Eye Centers. We've done this whole series on cataracts. This is a really big topic. So at what age should people really get screened for cataracts, even with no symptoms?
Yeah, so it's very common for people to develop cataracts. It's actually a normal part of aging. So it's actually not really considered a disease in what we think about it. So it can be as young as in your 30s and 40s, but more commonly it's going to be in your 50s and 60s when somebody's going to develop a cataract. But it is recommended that anybody starting around the age 45 to have a yearly eye exam. And that eye exam should cover cataracts and other things like glaucoma and diabetic retinopathy. So I would say that a good time to think about a yearly eye exam for cataracts is probably in your mid-40s.
Okay, so how does cataracts really impact daily living?
Cataract is essentially the natural lens in our eye that is clear when we're born, and then every birthday that you have after that, it gets a little less clear. So everybody's developing a cataract at all times. It's just that when it reaches that point where it affects your daily living, your function, that's when we talk about doing treatments. Then the treatment is cataract surgery. So it can affect anything from your reading to your driving. The earliest symptoms that we usually see, people start complaining about night driving. So if you ever notice that you're having trouble driving at night, the glare from the headlights is bothering you too much, reading in low light conditions. So imagine you're in a restaurant and it's kind of a dimly lit restaurant. You start to notice you're having a little more trouble reading than you would have a couple of years before that. Those are really early signs of cataract, and it's a great time to go get checked out for the possible need for cataract surgery.
Absolutely, and this is something that you talk with your patients every single day. And so what are some of those myths and misconceptions that you hear constantly from your patients?
Yeah, I think the biggest thing is people think cataract is abnormal. So again, it's something I mentioned earlier that it's something that happens to everybody. So it's really not something that is abnormal. It's not a disease in the sense that something went wrong. It's actually just normal aging. And so really, I tell people that if you live long enough, if you have enough birthdays, you're going to need cataract surgery. So the first thing is to realize that it's something that everybody goes through. And I believe it's still the most common surgery that's done in America. So we do a lot of cataract surgery. It's necessary for most people. That's probably the biggest misconception. And then the other one is that you have to wait until it gets really bad. Patients use the term, is it ripe yet? Which is not a term that we use or that I like to use, but you don't really have to wait until it's really, really bad to get cataract surgery. Whenever you start noticing a little bit of a change in your daily functioning, your daily life, that's the time to come in for an evaluation. That's the time to take care of it. Don't wait until it gets really bad.
Yeah, I would say so, especially if it's kind of impairing that daily living, like the driving, reading something, even if you have to pull it up close or if you're in dim lighting. So you want to stay on top of it. And so, again, surgery is very daunting for people. So what would you say to someone who is kind of weighing out their options and kind of make them feel a little bit more at ease?
Yeah, I think like I mentioned before, is that cataract surgery is very common. So a lot of people have cataract surgery, most common surgery that's done in America. Cataract surgery is a little bit different than what you think of when you think of surgery. Typically, we're not doing general anesthesia, so you're not being put to sleep. You're not having something put in, breathing tube or anything like that. You're awake, you're comfortable. We usually give a little medication that gets you relaxed. Your eye is numb, you don't feel anything, you don't see anything. So these are all things that people ask about. That when they actually go through the surgery, they say, actually, that was easier than I expected, and I should have done this years ago, is what people usually say. So it is a relatively quick and easy thing to do. We make sure that we do it right every single time, but yeah, that would be a misconception and something about surgery that people would benefit to know. Yeah.
It can absolutely be life-changing, and just don't wait until it's really bad. You can stay on top of it, and of course, get those yearly eye exams too to help with that. So thank you so much for stopping by today.
Yeah, appreciate it. Thank you.
So again, if you're interested in learning more, just go to eyecenters.com.